On this model, let me show you the course of the pudendal nerve. The pudendal nerve is formed by the ventral rami of S2, S3, S4. So these white wire coming from the anterior sacral foramina of the sacrum, they join in together to form this wire represent the pudendal nerve. The pudendal nerve then leaves the pelvis through this big opening, which is the greater sciatic foramen. On the posterior aspect of the pelvis, I pick up this wire, which is represent the pudendal nerve, coming in the gluteal region, and this area here represent the sacrotuberous ligament, and this area, white flap, represents the sacrospinous ligament. The nerves then passes through the lesser sciatic notch to enter the region of the perineum. This is this diamond-shaped area here. It passes along the side of the ischiopubic ramus. In this area here, it is covered by the obturator fascia. This layer of the obturator fascia makes a canal. This canal is known as pudendal canal. It's also known as Alcock's canal. And in this area here, the nerve can be anesthetized. In the pudendal canal, it gives three terminal branches. The inferior rectal nerve, which supplies the anal triangle. The perineal branches, which are not shown in here, will be going into the superficial pouch and the deep pouch and supplies the contents in this area. While the third branch, which is this nerve, which we are going to follow up on the superior aspect of the urogenital diaphragm, this nerve represents the dorsal nerve to penis or clitoris, and this will pass over the dorsal surface of the penis and clitoris and supply the skin over that area. The next important nerve which supplies the extensive area of the perineum is the pudendal nerve. Now pudendal nerve is a branch coming from the sacral plexus, and sacral plexus is formed. We can see the formation of the sacral plexus on the anterior aspect of the sacrum, formed by the ventral rami of L4, 5 joined together. This is lumbosacral trunk, S ventral rami of S1, ventral rami of S2, S3, and S4. And the pudendal nerve is a branch coming from the S2, S3, and S4. If I turn this pelvis on the posterior aspect, we can see the pudendal nerve exits. Here is the nerve, which is exiting from the greater sciatic foramen, which is this big opening, and re-enters the perineum through the lesser sciatic foramen, which is this opening around here. And that is your pudendal nerve. The pudendal nerve enters the perineum through the lesser sciatic notch and passes along the ischiopubic ramus, where it passes through a fascial canal, and that canal is known as pudendal canal or Alcock's canal. The nerve is anesthetized in this area here. In this canal, which is formed by the fascia of obturator internus muscle, it divides into 3 terminal branches. The first branch, which is given in the anal triangle, is the inferior rectal nerve, and the 2 branches which will continue on the urogenital triangle is the perineal branches and the dorsal nerve to penis or clitoris in female. Another nerve, which is, we can see some of the fibers of this nerve here. This is the posterior cutaneous nerve of thigh. This gives a perineal branch, and the perineal branch supplies the posterior 1/3 of the scrotum in case of male. In case of female, it supplies the posterior part of the labia majora. It's not that important a nerve. The main important nerve in the perineum is the pudendal nerve, because that supplies the sensory and motor in the region of the perineum.